The easiest way of finding the scapholunate joint is to pop the probe in transverse on the wrist and find the Lister's tubercle. So this is Lister's tubercle on the top of the radius, really easy to find. If you just move distally from there, nice and slowly, don't rush it, keep going. And then what you're looking for is what I would say looks like a small AC joint. So a smaller acromioclavicular joint. This is what you're looking for here. Okay, so on this side, we've got the scaphoid, and then here we've got the lunate. So what you can look for here is any widening of the joint. You can look for fluid coming out, but you also need to carry out a dynamic assessment. You can, at this point, measure the distance between the scaphoid and the lunate, and then you can assess it dynamically and remeasure it to see if there's any laxity. So there are a couple of ways of doing this, I would advise. The first one is just to go into ulnar deviation. So if we just go into ulnar deviation, can you see that nothing opens up? Those two bones stay exactly the same position and there is no widening of the joint. And the other thing that we can do is also get the patient just to slowly squeeze my hand, keep going and see if any fluid comes out, if there's any laxity in the joint, whether that's vertical or horizontal. So vertical laxity is where you see one of these go up and down, so you don't have this nice alignment. And horizontal laxity is where you get widening of the joint. You'll also notice that I'm using a gel bottle, which I find useful just to expose the joint a little bit.
Did you find that video useful? If you did, don't worry, we've got loads more videos for you. You can like our videos, you can make a comment, you can subscribe to our channel to get all of our new videos, and you can even join our membership. Good luck scanning.